Hi, you guys. Well, I spoke with community members today and health experts about COVID-19. One doctor tells me that we may have seen the winter peak already, but this new subvariant is something to keep an eye on.
There's a lot of things going on.
It's winter season. You have the flu, RSV, and 3 years into the pandemic, still COVID-19 persists.
I feel like naturally numbers were going to spike in the winter for the simple fact that, it's cold and flu season.
Currently, the CDC ranks 7 out of 8 counties in Connecticut at the high level for COVID-19 community transmission. But some health experts say that COVID-19 cases may have peaked for the season.
Well, the numbers climb right after Thanksgiving. And from what we saw, anywhere between January the 4th or the 6th was the highest numbers that we were seeing in terms of new positive. And then it's a little bit of a drop.
That being said, health professionals are still erring on the side of caution.
I'll just have one reserve, is like with this new subvariant, the XBB 1.5, which is highly contagious. Let's see how that plays into the numbers over the next few weeks.
Hospitalizations and deaths are much lower in Connecticut than they were this time last year. This graph shows that this time last year there were nearly 2,000 hospitalizations, about as many as the first COVID-19 wave in 2020. Now we're in the 700s with numbers trending down. It's the same with COVID-19 related deaths. This time last year the state was averaging 25 to 30 deaths a day, a big decline in the first wave in 2020. But now the state is averaging 3 to 8 deaths a day.
What changed last year was the introduction of Omicron. So you had both Omicron and Delta were competing for hosts, and Omicron was very contagious compared to the one we had before.
Dr. Anthony says that even though things are a lot different from a year ago, COVID-19 hasn't ended.
But what we still see people come in the hospital with COVID, and we still see people dying with COVID. So I want to say to the folks who think this is over, it's not.
Now, he, along with other health experts that I spoke with, say that if you do choose to wear a mask indoors, that mask should be an N95 or any type of surgical mask. In Hartford, D'Andrea Turner, Fox 61.